Hello.
Hey.
So sorry, I screwed that up.
Oh, you're fine.
Hopefully you weren't busy doing anything. I mean, I'm sure you were.
No, you're fine. We had a snow day today.
Oh yeah, us too. I mean, it's sort of just like cold day.
Yeah.
There wasn't any more snow. I'm sure you're in Kansas City.
I'm in Wichita, actually.
Oh, okay. Okay, very good. And is that where
Yeah.
you're from? Where are you from?
I'm from Olathe.
Okay.
So, yeah. And where are you from originally?
I grew up in Western Kansas. I graduated from high school in Oakley. So if you've driven to
Oh,
Colorado, you've driven right by it.
you've probably told that to so many people.
Yes, I do. I always say it's on the way to better things. You're like going skiing or you're going to the mountains for something beautiful, and there's like nothing in Western Kansas to stop for. So just nice people, we always say that too.
That's awesome.
Yeah.
Well, yeah, we can go ahead and get started. Like I said in the email, this shouldn't take but like 20-ish minutes, depending on how much you share, and that's up to you. So,
Okay,
if you want to start by giving your full name.
sure. I'm Kristi Darnauer, and I'm a family practice physician in Sterling, Kansas, and Lyons, Kansas. We serve the whole county of Rice County.
Great. And then your present title, you kind of mentioned, do you serve any other roles in your community?
Not currently, not officially. So, in the last year, I've been a consultant for our school district as they make decisions for COVID. And I previously was the medical director at our health department. So I will probably share more about that as we talk. But
Perfect. And
yeah,
then where did you attend medical school?
I went to KU for medical school in Kansas City.
Awesome. And then where did you complete your residency?
Research family practice residency in Kansas City, Missouri.
All right. And then can you speak a little bit about your current position and what you do on a daily basis?
Sure. I am a family physician doing full scope family medicine. So I work in the clinic and our hospital on call. We work weekends covering the emergency room, and I still deliver babies and do C-sections. So that's my day to day. I technically work part time, so I'm home a little bit with my kids. I have 3 kids, and they are as much work as my work days most of the time. So
I can imagine. And then can you tell me a little bit about the patient population you serve in Sterling?
yeah, we have a wide variety of ages. I deliver babies, so I have newborns in my practice, and then I also take care of nursing home patients. So it's the full spectrum of age. And then from a sort of socioeconomic standpoint, are as many rural areas where we have a fairly impoverished population as well, working class, some immigrant communities that we serve here in our county as well.
All right. So, we're going to talk next about COVID. So, what unique challenges did you and your practice face with COVID-19?
Sure. I think from a practice standpoint, one of the, you know, kind of everywhere medicine, all of a sudden, everything was dangerous. And so we pulled back from an in person standpoint with our office visits. We started to do a lot of telemedicine fairly early on in the pandemic in order to still safely see our patients and connect with them and provide them medical care, get their prescriptions filled, and those kinds of things. So we started doing that early on. We also started to rethink everything we did and every encounter we had with even our coworkers. So we were pretty early mask adopters here in our practice from the very beginning, and even among each other, which, like that ended up being wise because a lot of places got shut down early on when the whole sort of work environment got exposed and infected and offices had to close. But so that from a work standpoint in our workplace, that definitely changed the way things looked for a while. But also because we're in a small community, there's only 4 doctors in our county, serving about 10,000 people here in the county. And then we draw from outside of our county as well. but we were suddenly the local experts in COVID as well. So my work became a lot of after hours work where I was doing a lot of reading and grasping for anything out there to figure out how to lead our community in all things COVID related. And so that became my primary work. I feel like, especially as we were, a lot of people were kind of scared initially to come into the doctor's office, so our clinic numbers dropped fairly significantly, as everyone's did. And so a lot of my time was spent coordinating efforts locally and communicating with other physicians, and really researching a lot. So
Okay. So, what barriers and obstacles did you face early on in the pandemic?
I think I made some notes. So I was just reading to see what I wrote. I think early on, um, there was just a whole lot of unknown, and so there was fear initially for all of us. Like, what did this mean? Were we going to get exposed? Was this going to be like sort of this martyrdom of healthcare workers because we were treating this uncurable disease sort of idea? Um, so I think there was some personal challenges to that, just as people talked about healthcare heroes early on. There was this sense that we were kind of entering into a war zone as healthcare providers. But that doesn't come without a cost. We also are human beings with families, and I have three small kids. And so there was just some personal fear early on, especially in the pandemic when things were really unknown. Everything was unknown. So that was a challenge personally. We're in a rural community, and so there's no shortage of political opinions, which is probably true anywhere. But all of a sudden, the pandemic became very political, and our community was very divided. And so I would say, if I look back on the last year, the greatest challenge we faced was the division on how this thing should be handled, and who should really be in charge of that, and which political party should be in charge of that. And so there were a lot of challenges with that, because as we as physicians in the community would make recommendations to, say, our local government, it was met with resistance, and it was met with anger at times, because of this sort of political tension that had developed in the early days of the pandemic.
So, how did you end up handling that? Did you just push through it, or was there anything that ended up working in your favor to, protect as many people as possible?
Yeah, that's a good question. So my role, I've been here in Sterling practicing in Rice County for 10 years to almost 11 now. And in that time period, I had been the medical director for our local health department. And that job was really, for the most part, a very like sign the orders at the end of the year, attend the annual meeting once a year. They called me maybe once a month with a question about, some protocol or a vaccination, error that had been made, and we had to document it and those kinds of things. It was a very hands-off sort of a role. I was just the medical director. I got paid $125 a month, to be the name at the bottom of the protocols. So then March 2020 rolls around, and all of a sudden we're in this pandemic, and the health department director was actually slated to retire in the summer of 2020. So we started scrambling, trying to figure out how we could replace her, how we could, do all the things that were all of a sudden required for the pandemic, and do it with someone new. And so there's a lot of conversations that happened, and I went to our county commissioners with some of my recommendations for the position, and I was met with tons of resistance. They were very rude and disrespectful, to me, as I was trying to make recommendations that I felt like were necessary. We really needed someone in that position who could lead our county through this next year and through the pandemic. And so because of a lot of that sort of drama, I ended up actually stepping down from the position, which was very difficult for me to do because here I am, a physician leader in my community, and I'm essentially walking away from a position of influence during a pandemic, which was really hard for me because I felt a loyalty to my patients and I felt a loyalty to my community. But at the same time, they weren't listening to any of my advice, and there was no respect there for my medical expertise. And so I had hoped that walking away would send a message that they needed to consider what I was saying and take it under advisement. None of the other doctors in our county were going to step into that role because of the way I was treated. And we thought that would send a message, and it didn't. And they continued to make the decisions they wanted to make, which were most of the time at odds with what we were recommending as a medical community. We were making recommendations that were pretty standard CDC recommendations and KDHE recommendations, which were, mask mandates early on, limiting of large gatherings, just some of those basic things that were recommended early on. And again, because of the sort of political divide that had happened, we're really just got a lot of pushback. So I stepped away, and honestly, from a personal standpoint, it was probably the right thing to do. You sort of find yourself in this toxic environment where you're giving advice and no one cares. And so at some point you say, okay, well then I guess I will stop giving advice, and you can come to me if you change your mind. But I literally, my husband and I spent the day before 4th of July walking around our little town, handing out masks that we had bought in order to try to help protect our community. And some people were grateful, I think, and some people understood what we, were trying to do. And it was our way of saying, even if there's not a mask mandate, we should still do this for each other. We really care about each other, and this is one way we can show it. So some people received it. Probably some of those masks are in the trash,
Hopefully a small percent.
Right, hopefully.
So you kind of already mentioned this, but how did you manage the professional life and that personal life? Is there anything else you want to add to that?
Well, I left social media. So one of the most sort of divisive places I feel like was social media during that intense time period. And I live in Sterling, is a town of 2,000 people. So the people that I care for in my office are coaching my kids' baseball team and are teaching my kids at school and go to church with me, and we see each other at the grocery store. Like, it's a very enmeshed world. And so in that world, things seemed fine. We're kind of good at that, like smiling at each other and interacting cordially. But then in social media and on Facebook, it became very divisive, and there were things said to me, about my colleagues, that were really awful. And so leaving social media was a boundary that I set for myself, sort of to preserve my soul in the midst of it. I became fairly disillusioned about some of the people in my town. And I know that people say things that they wouldn't say to my face, but they can easily say it behind a computer screen. And so I was able to step away from that and then continue to function in this role without bitterness and without frustration, or at least not as much of those things, because it wasn't a constant onslaught of that negativity. So that helped. That helped me personally sort of maintain that. And then a lot of self-care. The pandemic is such an interesting thing because, as doctors, we're trained to take care of people when they're sick. And there was a part of me that just wanted to do that. Like, can't I'll just give me the COVID patients. Like, at the end of the day, I'll just take care of sick people because that's what I'm trained to do. And instead, we were like thrust into this role where we were public health experts, and we were advocating for these public health measures that was really uncomfortable. And then getting a whole lot of backlash about it. Like I tell people, like, I'm used to people not listening to my advice, right? Like I tell them to quit smoking and they don't, or I tell them to lose weight and they don't. Like I'm used to that, but I'm not used to them like screaming obscenities back at me about it, or sort of questioning my motives in the whole thing. I'm not used to that, and that's where it got personal, and that's where it got hard. And so I feel like that was sort of what made this pandemic unique, is that we weren't just healthcare heroes out there taking care of sick people, although we were that. I mean, I have taken care of my share of COVID patients this year. But that actually seemed like the easy part compared to the community and social um, interactions that I had over the last year.
Has that gotten any better throughout the year, do you think?
Yes, it has. I do think it has. I think it was probably, for me, at least at its peak, sort of in the summer months, which is crazy because we had our numbers really were low at that point. And maybe that was some of the pushback, right? Like
Yeah.
the community felt like, oh, it's not really here, it's somewhere else. But as rural providers, we recognize that anything happening in the city trickles down to us, because if the hospitals are full in Wichita, I have nowhere to send my sick patients to. And so we could sort of see that as writing on the wall, and that may not have been as appreciated by other people. Um, but I think that was some of the pushback that we felt. And I do feel like things have gotten better. Of course, I'm not on social media to know what people are really saying, right? But I do get more of a sense of people saying, we understand where you were coming from. We may not have agreed with it, but I see more people wearing masks in my little grocery store. I see, maybe it's just a general resignation of this is how it's going to be for a while. There's not as much fighting against, like, kids wearing masks in schools was a really big deal for us. And something really important, as I was kind of advising our school district, I said, we really have to make this happen. And we did. We have had kids in masks in our little school all year long, and they've been in school all year long. So I think that speaks to that success. But there's a lot of pushback from parents about, they didn't want to send their kids to school in masks, and I feel like some of that has faded, and people are recognizing that it was sort of a necessary evil in order to get kids to stay in school, and they're able to participate in sports, which we weren't sure was going to happen as summer was rolling through. So some of those kinds of things, again, I feel like it's almost sort of this like resignation, like, okay, fine. A compromise has happened, maybe against their will and maybe a little, reluctantly, but it's happened. And I do feel like less of that negativity.
Good. Um, so let's see. If you could start the past year over again and do things differently, what would you change?
Oh my goodness. Yeah, maybe some emotional resilience for myself on a personal level. Like I said, I the reading, I've done a ton of reading, as everyone has, learning everything I can about COVID, um, and learning how to treat it and learning how to care for the COVID patient, again, was the like easier part in relatively speaking. And these are really sick patients, so like it's crazy to think that that was the easy part. But um, just if there was some way that I could have prepared myself for that emotional onslaught. And it's hard to know, like, we as people, all of humanity, have been under a crazy amount of stress in the last year. So would there have been any way I could have been any more prepared? I don't know, but that would have been nice.
Yeah. More snow days or
Yeah,
something.
there you go. Yeah.
So who, other than you mentioned already some coworkers, who did you work closely with during the pandemic that really helped kind of drive community safety and things like that?
Yes. So actually, I was asked early on to be a part of a group called the Kansas COVID Work Group for Kids. It was started by pediatricians mostly, but there's some family docs in the group, and some school psychologists, some school nurses, some community psychologists. And this group was formed probably June. with the idea of trying to evaluate back to school safety. What did that look like? What does COVID look like in kids? What's our actual risk here? Some of the sort of pediatric related things. So I've been on that group. We've met pretty much weekly since the summer on Zoom, as all the meetings are. Yes, and I have really been so grateful for that group. I feel like the camaraderie there, the sort of like we're not alone in the trenches sort of feeling, the information sharing that happens there, and the like, this is what we're doing in our community, and let's, take this and use this in another community. That kind of collaborative has been really helpful, and kind of life-giving in a way, because you're speaking with other people who are like-minded and who are, talking about doing the same kinds of things, and that's always affirming. So that has been good. I feel like I've been able to network with other physicians and other professionals outside of even just my colleagues. My partner, Dr. Stacy Dashiel, we work really closely together on all the things, and we, when the weather was nice, we were taking long, 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 long walks, talking through all the things COVID and trying to sort out how to best lead in our community. So that has helped, having that kind of connection too, because it really is like, I can't imagine doing this alone and trying to do it without that kind of support.
Yeah. So what kind of changes brought by COVID-19 will be permanent?
I think from a practice standpoint, a lot of the telemedicine will stay. And I think, in lots of realms, some of this like work from home will stay for people. Some of the Zoom meetings will stay for people. So I think some of those kind of technology things that we've realized we don't actually have to be in person to do some of these kinds of things. It's freeing. It's so patient friendly. Like, I've got moms with 3 young kids that are actually able to like make it to an appointment because they otherwise would have to find childcare. I've got patients without transportation that have a smartphone, and so they're able to talk to me on their phone. And so some of these kinds of things, I think, are here to stay, and that's a really good thing. Um, I don't know how I feel about what public health is going to look like going forward. I feel a little bit concerned about, what kind of sort of damage has been done, um, in relation to public health advice, and then what it looks like on the receiving end for communities. There's this new tension that's been created about sort of who's in charge, who gets to make these decisions now. Is it, local government, or is it local health departments? Um, and so I guess I don't know how I feel about that. Concerned, I guess, because I think there has been some loss of trust in the community, that people maybe don't know exactly what to do with health advice. For some reason, there's been doubt about even doctors' motives and the advice that we give. And I feel like that maybe distrust has always been sort of brewing in different groups of people, maybe like in anti-vaxxers, or people who prefer sort of alternative medicine. Those kinds of things have been brewing, but now it seems more widespread. It seems like more people are questioning medical advice, questioning doctors' motives. So I think that'll be something to be undertaken in the future and addressed. How can we rebuild trust in people? How can they trust us again as leaders? And how can we demonstrate that we're trustworthy? So I don't know, that's probably a negative that's gonna take some time to undo.
Yeah. So we're actually going to talk about students in residence next, who have the big undertaking of that. But how do you see COVID-19 impacting the learning of students in residence that are in family medicine?
Well, we have not had students for most of the pandemic. So we typically take students out here, and love it. And we've maybe only had one since during the whole pandemic. So I think just the hands-on experience has, at least in this last year, definitely has been affected. Going forward, I think this will have been one of those moments in training that you look back on and think, man, I'm so glad I was in training for that so I could see all aspects of it. And I think it will be, um, I mean, it's an education. It's just a different kind of education, right? And maybe a little atypical compared to what the curriculum said you were supposed to learn this last year, right? Um, so I think it's there, it's different. I don't necessarily, I feel like student and resident education is generally so well done that you're not going to miss anything. So this year was crazy, but you're still going to learn all the things that you need to learn, and you're still going to be prepared to go out there, and you're just going to have this other sort of tool in your toolbox that you wouldn't have had there not been a pandemic.
Yeah, that's a great outlook to have on that. Um, so, what is your sense of where family medicine is going in the future?
So, like I said before, I think family medicine doctors, at least out here where we're the only doctors, um, we ended up being public health experts. We ended up being, community leaders in a way we hadn't been before. We ended up being community targets in a way we hadn't been before, but right, yes, both things. But uh, I think there's an opportunity to continue to be leaders in our communities throughout this as we continue to rebuild that trust, like we talked about. I hope that we can continue that because family medicine is, as those of us in family medicine know, the best specialty to be able to connect with patients, to make lifestyle sorts of changes, to affect communities. And so family medicine is poised to be able to be the leaders in this kind of an environment. And I think we have been. I know, again, I'm biased because we're the only ones here. So family medicine has been doing the bulk of the work. And of course, we are so grateful for our ID colleagues and our ICU colleagues, but we're the boots on the ground who are attending the meetings and saying, we need to get everyone vaccinated now, and this needs to be a priority. And how can we facilitate this to happen? So, family medicine, as always, has as much of a seat at the table as they will take because I think that opportunity is always going to be there. And we're just poised to be able to do it well if we're given the tools. And I feel like, our organizations have been helpful in empowering us and giving us tools that really have enabled us to do that this last year.
Yeah, good. So, any views on important issues in this specialty related to COVID-19 that we haven't addressed or that you'd like to share?
I wrote a little note that said burnout because I think,
On that?
yeah, I think whenever you add anything else to people's plates, that is a risk. And so, on the same hand that I'm saying, family medicine can do this. Family medicine is really already, maxed out in most of their communities and in the roles that they play there. So, I think you just have to be aware of it as and our specialty has done a good job. They've, tried to make connections with physicians and increasing the awareness of this idea of burnout. I would guess that you can't meet a physician who's lived through this last year who hasn't experienced some form of burnout. And maybe every person, right? Like we've all been affected by this in such different ways. But I think that would be something going forward we'll continue to address or need to address so that we can continue to do this job and to do it well.
Yeah. Anything else you'd like to add?
I don't think so. I think we covered most of my little notes of things I
Yeah.
thought we should mention.
Yeah,
Yeah.
I'm gonna go ahead and stop the recording.